All right. Awesome. Hey, everyone. Thank you so much for joining us tonight. My name is Marissa. I'm one of the co-founders of Beaming Health. We're so lucky to have Max Meyerhoff with us tonight. Max is an incredible, just knowledgeable human when it comes to all things healthcare, health insurance, and autism. We're so lucky to have him. I'm going to start off with a quick intro to Beaming Health, and then we'll jump into what you're all here for, the main event, Max, and his wonderful knowledge and expertise. Quickly on Beaming Health is first and foremost a place that is working to make it easier for families to find everything they need, whether it's speech therapy, camps, you name it. We want to make it as easy as possible, which you can do right on our homepage at beaminghealth.com. We also have a great community feature. There's a link that should be popping up on your screen now if you're interested in joining our community. It's all free for families. The whole site's free, where families can ask questions to experts like Max and other families in their area. And then lastly, we have a great learning center full of content and different articles where families can get up to speed on all things autism. And without further ado, I'm so thrilled to have Max here with us today. Max has been working for years in health insurance. Bless him. He's one of the good guys. He's helping families resolve all kinds of insurance issues and is here to go back and forth with me for the first half of this session, and then we'll open it up to the audience for specific questions. But throughout the session, if you have any questions, feel free to send those in the chat, and we'll make sure to get to those. With that, Max, anything you want to say before we dive in? Uh-oh. Max, we can't hear you. Oh, no. I was just hearing you a second ago. No. Uh-oh. Let's see. Oh, no. Thanks for your patience, everyone. Give us just a minute. Yeah, Max is going to try and log off and come right back on. Thank you to anyone. If you're just joining us, we're getting Max set up, having some slight technical difficulties, but we will be live here in just a moment. Hey, there he is. Yes, loud and clear. Perfect. Thanks, Max.
Excellent. Sounds good. Well, thank you for that introduction. The world we live in, virtual worlds always mean that we love technology. So thanks for bearing with me. No, I think that you said it well. I used to work for one of the large health insurance companies, serving as what was called a family advisor. And so in that role, I worked directly with a caseload of families to help them navigate the many complexities of health insurance. It can be a really challenging and frustrating topic for a lot of families who have kids with special needs. And by understanding a thing or two about the jargon and the ways of navigating that system, it can make a really big difference for families. And hopefully some of these key pieces of information that we'll go over here today can help you feel a little bit more confident about navigating that system.
Love it. That's perfect. All right, just to kick us off, something I hear all the time from different families is just, what's the best insurance plan for me and my family? A lot of the care, of course, can be so expensive. I'm sure you hear this a lot.
Yeah, absolutely. No, it's very true. And it can be challenging to even know where to begin. And so if we go to the next slide, we can start talking through some of the terminology about choosing the right health insurance plan. So typically what happens is that if you receive insurance through your employer group, you'll receive a bundle of information either when you join for the first time or during open enrollment season, which is usually in the fall when you're allowed to pick your health insurance plan. And what happens at that time is you receive all this information about benefits, time off, your health insurance, pay, whatever it might be. And it's easy to sort of quickly skim through and select a plan off the cuff instead of really digging into it. And while all that jargon and terminology can be hard to handle. Knowing a thing or two about it can make your decision really pay off big time in the future. So a few of the terms to be aware of when choosing your health insurance plan. The first term is a deductible. And so a deductible is that amount that you pay for the covered healthcare services before your insurance starts to pay. So a deductible could be $500, it could be $1,000, maybe you have a high deductible plan of $3,000, and that's the amount that you'll be paying out of pocket, which leads us to that next term, which is the amount of money that you pay out of your own pocket for medical expenses until insurance kicks in. And so there are two pieces to be aware of when thinking about those out-of-pocket expenses. The first is how much you're going to be paying out of pocket before you hit your deductible. So again, $500, $1,000, $2,000, whatever it might be. And then the second piece is what's called an out-of-pocket limit. And so an out-of-pocket limit is the maximum amount that you'll be paying out of pocket for health services in a given year. And so that out-of-pocket maximum might be $5,000, it might be $10,000, but it's a good number to be aware of when selecting a health insurance plan so that you have some reassurance that if everything goes horribly wrong and you have tons of health expenses in a given year, that's the maximum amount you'll be paying out of pocket for an in-network provider over the course of that 12-month period. The next term to be aware of is copay. And the copay is a fixed dollar amount that you pay for a certain healthcare service after you've hit that deductible. And then the last piece to think about is that premium. And the premium is the dollar amount that you pay. Usually it's either every other week during your paycheck, or maybe it's once a month that you're paying for your health insurance plan. Typically, how the premium works is that your employer will pay the vast majority of the health insurance expenses. So they might pay 70, 80% of the expenses to cover you and your family, and then you chip in the rest with that premium. And so the two terms here that I would really have you focus on when we think about just the financial aspects of choosing the best health insurance plan is deductible and premium. And the next slide, we can walk through an example of what are some of the things to think about as you're doing some of that mental math. So as we're thinking about the best plan from a purely financial standpoint, like with any type of insurance, whether it's health insurance, home insurance, car insurance, if you were able to perfectly predict how much you were going to spend in that category over a year, then it would make the decision really easy. And so while it's hard to exactly predict health expenses because our health is variable and unpredictable at times, for the most part, after a few years of understanding what the health expenses are for you and your family, you can start to get a sense of, in general, this is what I pay for health expenses in a given year. And once you have a sense of what that total dollar amount is, you're able to make an informed decision about which plan is best for you. So to walk through this example here, we have two different plan options. They're similar, but they have some key differences that we'll go through. So both of these plans cover 80% of the cost after your deductible is met. And so they're still going to cover the same amount, but we have to first hit that deductible threshold. And so Plan A here has a $50 premium every 2 weeks. So that comes out of your paycheck. And it has a $1,000 deductible. So that means you have to first pay $1,000 towards your health expenses, and then the insurance will kick in at that 80% threshold. Plan B here, however, has a lower premium. So it's only $20 every 2 weeks that you pay towards covering those health insurance expenses, but it has a higher deductible. So we see there's a $3,000 deductible here. So it's going to take you longer before the health insurance kicks in. So you can see here some of that napkin math at the bottom. If we multiply that $50 by over the course of a whole year or those 26 pay periods, then you would have $1,300 for the year plus that deductible, which gives us $2,300. And on the flip side, it's only $520 that you're paying in premiums, but if you're spending the full $3,000 to reach that deductible, then the cost is going to add up to $3,520 to hit that deductible before the insurance kicks in. And so this is just a simple example of how you can think about doing some of that mental math when selecting whether you want a high premium, low deductible plan, or whether you want a low premium, high deductible plan. My advice for most families that I worked with who had children with special needs was that you want to think about what your health expenses are going to be over the course of that year. And most of those families have a lot of health expenses. There's complex procedures, there's speech, occupational, physical therapy, there's a variety of services that you might need access to. And so if you expect that you're going to have relatively high health expenses over the course of a year, typically it makes more sense to choose a high premium plan that has a lower deductible so that the insurance starts paying for those services earlier in the year.
Got it. So you would, generally speaking, opt for something more like the first plan if you're considering a plan for you and your family.
Yep.
Got it. Super helpful. And anyone, again, feel free to chime in with any questions. We'll try to answer them as we go and make this as interactive as possible. Not that health insurance isn't the most riveting topic ever. No offense, Max.
It's everyone's favorite topic. I get that all the time. Yeah. So when we think about some of the other considerations, so we talked through those financial aspects of choosing the right health insurance plan for you, but there's lots of other complexities to choosing the right plan that I want to make sure that we touch on. So there's 4 different pieces of this puzzle. The first is the services that you're using. So what are the types of services that you and your family need or use on a regular basis? And so there might be a plan that's being offered through your employer group where speech therapy is covered as a copay and it's separate from the deductible. So that just means every time you go and see a speech therapist, it's $20, $30 out of pocket every single time, and you don't have to worry about that deductible. And so it's important to take a look at the health plan and see, are there particular services that are most relevant to my family? And if I think I'm going to be using those services a lot, it's good to see what those will be covered at. Oftentimes, all the services are covered at the same 80% until after you hit that deductible. But sometimes there are certain services, it's pretty common that a standard PCP visit or maybe a specialist visit would be covered through a standalone copay. And so it's important to look at what are the services that me and my family are going to use, and are those covered any differently on the various plan options. The second piece to think about is prescription and pharmacy use. And so there's a list of medications on any health insurance plan that are considered covered at different levels. And what that is called is a formulary. Again, trying to not use too many terms here, but a formulary is basically just the list of medications that are covered on a particular health insurance plan. And so it's useful to be able to, if you know that for yourself or your spouse or your child that you use a medication on a regular basis, it's good practice to go in when you're choosing that plan to double check whether you need to talk to HR, you can call the health insurance company, sometimes there's an online portal you can do it, but to take a look to make sure that if I know that I use a certain medication on a regular basis, make sure not only is that medication covered, but at what level is it going to be covered. That's another piece to contemplate. The third piece I would think about here is frequency. So how often are you seeking services? We touched on this a little bit before, but if you know you're going to be seeking services regularly, then choosing a plan that has a higher premium and a lower deductible is probably a good fit for you. And then lastly, thinking about what providers are in and out of network and what specialists you want to see for you or your child is also an important consideration. If you've been seeing, a particular ABA provider for autism for many years, and you suddenly have to change to a new health insurance plan, it could be, challenging or frustrating if suddenly that provider is out of network with the new plan and you have to build a new relationship and rapport with a whole new provider. And so if you have an option of selecting plans and you know that there are certain providers that are important and you want to see them on an ongoing basis, then you can search that provider's, the health insurance list of in-network providers to see, is this particular specialist or provider in the network, to ensure that that person is going to be covered and that you can continue to see them instead of being forced to uproot or change that care. So I think those are some of the other additional pieces to think about when you're choosing the right health insurance plan. The financial piece is, of course, part of it, but figuring out the personalized and right fit for you and your family is also an important consideration.
Totally. Yeah, Max, I really like that. I can imagine a family, for example, making a list of just, these are the different therapies that my child's seeing at what frequency in a given year, and just understanding which bucket's the largest cost and making sure those things are covered across the whole family. That makes so much sense. Are there any services in particular that came up a lot as problem ones, or ones where benefit limits? Also, maybe just talking a little bit more about what that is specifically, just if there's one in particular. I suspect there is.
Absolutely. I think understanding benefit limits is really important. If you flip to the next slide, some questions particularly on, actually, if you go one more, we can talk as well about specific benefit limits too. So when we think about sort of certain services that are covered or not covered, it can be an important piece of that puzzle as you figure out which insurance is best for you. And so like you mentioned, Missy, there are two different types of limits on health insurance plans. There's what's called a soft limit and a hard limit. And so we see this all the time in health insurance plans when it comes to certain therapies. For example, physical, occupational, speech therapy, they almost always have a limit on that plan in terms of how many services you're allowed to receive over the course of a given year. And so sometimes there are what are called soft limits. So it could be written into the plan that you're eligible for 20 visits of speech therapy in a given year, unless you meet medical necessity or have a certain diagnosis saying that you need more services. And then you can apply for an exception through the health insurance plan along with your doctor to say, I need these additional services because of a particular diagnosis. And then the insurance can approve you for an additional 20 visits in a year, or whatever it might be. So soft limits are something that are flexible and something that you can work with your provider and your insurance to figure out how you can maximize those benefits and get the services that you need. And if you were to call up your insurance company and you said, I see that I have a limit of 20 visits for speech therapy, is that a hard or a soft limit? They can walk you through the plan and explain to you if this limit is rigid or flexible. And on the flip side, as I've been alluding to, hard limits are limits that are rigid, but there isn't any flexibility there. And no matter how many times you submit an appeal to the health insurance company or call them or work with your provider, the health insurance company unfortunately isn't going to allow any additional services. So that's not to say there isn't still hope if you have hard limits. We can talk through some of those strategies a bit later, but it's important to understand the distinction between hard and soft limits, so where to spend that energy and when to go and advocate and fight for their child and when to seek alternative options.
That's so helpful, Max. One thing that's striking me as you're talking with the answers to all these questions is just knowing hard versus soft limits, knowing what providers are in and out of network. There's a lot of detailed information. I know when I've shopped for a plan, they don't usually come out the gate giving me all the information I need to make a great decision. Do you have thoughts on basically what it's typically the route or path for a family who say wants to know, okay, yeah, this is my favorite speech therapist, I want to make sure she's covered, or things like that type of information? Yeah, how do families
Absolutely.
get this?
Yeah, I would say sort of step one, if you're trying to figure out more of the plan details, is to talk to your HR group, right? Like if you're getting your insurance through your employer, they're going to have a lot of those additional details. So maybe that initial packet that we talked about has a pretty high level information. But if you reach out to them and say, hey, I want to get more information on my health insurance, figure out who's going to be in network if I'm selecting this plan, they can either send you to a link or a website that you're able to research that further, or they can connect you directly to someone at the health insurance company who can further assist. So I think that, for all parents who have kids with medical complexity and special needs, working and trying to advocate for your child requires a lot of patience and perseverance. And so I would encourage you to not give up if that first door closes, but continue to talk to different people at HR, reach out to the health insurance company, figure out, do what you need to do to get the information that you need and deserve to be able to make that informed decision. And not to make an entirely shameless plug, but we have great resources at our community page within Beaming, and it's been really exciting to see that community grow, and there's been lots of good questions from people on that community. So I encourage you, if you're struggling and just don't know what to do or have questions about that navigation, reach out to us at that community and we'll be more than happy to assist.
Love it. Thanks, Max.
Yeah.
Rewinding just a little bit.
Great.
Do you think, does it still make sense? We can talk a little bit just about benefit limits and prior auths in particular.
Yeah, absolutely. So again, a few more pieces of terminology to think about. So we had mentioned these already, but the in and out of network, I think, is really important for people to understand when they're choosing a health insurance plan and when they're subsequently selecting a doctor that they're going to go to for their health services. So an in-network provider is someone who is contracted with a health insurance company. And what that means is that they have an agreement with that health insurance company that says, every time I see someone for speech therapy, I am allowed to charge that person $100, and that is the limit or the amount that I'm allowed to charge for those services. And then the health insurance company will either pay that provider directly, or if you haven't hit that deductible yet, then you'll be responsible for that $100. The out-of-network providers, on the other hand, don't have a contract with their health insurance company. And so this leads to a variety of issues, but two that come to mind is that one, if they're out of network, it means that it's going to be a lot of paperwork and challenge to actually get the health insurance company to pay those services, because what can often happen is that they won't be willing to submit the claims or those medical expenses directly to the health insurance company. So it means that you're forced to do a lot more of that paperwork to get the receipt and the claim, and then you have to submit it to your health insurance company, and then it processes through their system. So not only is it a lot more legwork for you to go to an out-of-network provider, but it also means that you're oftentimes paying a lot more money, because either you have what are called accumulators. So we talked about this, like working up towards your deductible. And so for an in-network, you might have a $1,000 deductible. Your out-of-network deductible might be $5,000. So not only might it take much longer to hit that deductible if you go out of network, but importantly, as I mentioned before, there's no contract with that provider and the health insurance company. And so what that means is, in our first example, there's a speech therapist, and they're allowed to charge $100 for a particular service. But if it's an out-of-network speech therapist, they might say, we are charging $250 for this service, and there's nothing that you can do to, you can work with them a little bit, but there's no sort of contractual obligation that they have to charge any less. And so because they're not mandated through that contract process, it can mean that it takes a lot longer to hit your deductible. It means a lot more paperwork for you, and it can mean that you're paying a lot more for each individual service because there isn't a contract. So we can talk for the whole hour about the challenges of in and out of network providers, but I think the broad message is that it's important to think about the network status of the providers that you're seeing, and that you're making an informed decision with that. And closely connected to that concept is this idea of a prior authorization. And so a prior authorization is when a provider that you're seeing submits a letter of medical necessity or some information to the health insurance company to say, this patient is interested in seeking a particular service that maybe is especially expensive, or maybe it's a sort of novel treatment that doesn't have as much evidence behind it. And so typically what happens is that providers will submit all this information. The health insurance then, providers or doctors at the health insurance company will make a decision as to whether it meets the plan guidelines and if you're approved for that service. But again, prior authorizations are something that in-network providers are required to do on your behalf. So they do all of that paperwork and legwork for you, whereas an out-of-network provider might not do so. So like I said, there's lots of good reasons to do your best to stay in network, but prior authorizations are one of many, because it can be a lot of legwork and paperwork to submit all of those prior authorizations and to make sure that you're actually going to be covered for the services that you're receiving.
Totally, yes. And one question that came in around prior auths is just whether, just with the prior auth, let's see, let me make sure I'm understanding this correctly. Yes, common reasons that the prior auths maybe don't go through that you saw, like common reasons for services to be denied.
Yeah, absolutely. Well, I think that there's a few different reasons why an authorization might be denied. The first is that it's not a covered service. So like I said, typically health insurance companies are mandated through CMS, which is the Center for Medicaid Services, about like what services are a covered service and what services are excluded. And so if it's a brand new therapy that doesn't have clinical efficacy behind it, then it might not be a covered benefit. And so that's one of the reasons why an authorization would be denied if it's simply not part of your health insurance plan. It could be that there are other types of more experimental services that are received. I had an example in my former role where there are individuals with a rare autoimmune condition called PANDAS, and there's a treatment for it called IVIG. And there's a lot of sort of back and forth in the community about the efficacy of IVIG and whether or not it's effective or not. And as a non-clinician, I won't weigh in on that discussion, but what I can say is that it often wasn't a covered benefit on the plan because of that sort of lack of clarity regarding the efficacy of that treatment. So that's one of the reasons. The other reason why an authorization might be denied is that the doctor hasn't submitted sufficient information. So maybe you're requesting a standard service like just a authorization for speech therapy, right? But they haven't submitted clinical notes that say, my child has autism and needs to receive speech therapy to improve improve their communication or whatever it might be. And so if the doctor hadn't submitted sufficient information, then it will be denied for lack of information or lack of medical necessity. And then there are ways that your in-network provider can work with the insurance company to dispute that determination and work to get it overturned. But either the service is denied simply because it's not a covered benefit, or it might be denied because there's not they submit enough information to provide more clinical rationale.
Got it. Super helpful, Max. And yeah, the panda stuff is super relevant for my own family. Another great question here related to all this stuff with prior auth, network, out of network. Just, is there typically a person at your insurance company who, when you're having issues with services being approved, maybe because of prior auth or other reasons, or insurance just isn't paying what they're supposed to be paying, like, where should families be going with those challenges generally?
Yeah, absolutely. Well, what I'll say is that it really depends greatly from insurance to insurance. Some insurance companies have specialized teams, like the one that I worked for that was dedicated to kids with special needs. But unfortunately, it's not nearly commonplace enough. And so I would encourage you to certainly reach out to your health insurance company and maybe reach out a handful of times until you get connected to that kind soul who's actually willing to work with you and help you sort through some of these challenges. And I would encourage you to work directly with your HR group as well. Oftentimes, employer groups have a lot of leeway, or at least power to be able to negotiate with the health insurance companies, because they're paying these health insurance companies lots of money to cover their whole swath of employees. And so while it might not help you with an individual case, if you say that, again, let's go back to the IVIG as an example. If you say that I believe that IVIG needs to be a covered benefit for me and my family moving forward, the employer group during that renewal period with that contract could say to the insurance company, we want this to be a covered benefit. It's important to us. We're only going to sign on if this is going to be covered moving forward. And so because they're able to negotiate on behalf of the entire workforce that they're employing, they typically have a lot more negotiating power. And so if you do have challenges, like I said, I encourage some perseverance and persistence on your part by trying to connect with the health insurance company. And don't be afraid to talk with your HR group about these challenges. They might be able to help you with a one-off case, and they almost certainly can work to advocate on behalf of their broader group of employees, when they're renewing their contract with that particular company.
Yep, makes sense. I know I've heard that before, just from insurance plan contacts of, yep, if we get less complaints, that's always a good thing. So
yeah,
let's see. All right, next super fun thing here is just, we often hear a lot about secondary insurance coverage. What is it? Why would a family want it? How can they get it? Can you shed a little light on that?
Yeah, absolutely. Whenever, when I was working with my case families, I would talk their ear off about the importance of secondary coverage. It can be frustrating. We've talked in this session already about whether a particular service isn't covered or whether there's a hard limit on a particular service. And there's just, no matter how much advocacy you do on your child's behalf, it's not going to be a covered service. And so that's where having a secondary insurance option can be really great, because it can provide that safety net, so to speak, of having an additional support to be able to step in and cover some of those otherwise non-covered expenses that your primary insurance might not cover. So there's a great system that exists across the United States. It's administered on a state-by-state basis, but it's called Medicaid waiver. And Medicaid waiver is basically a subset of the Medicaid program for kids specifically with complex medical conditions and developmental disabilities. And the waiver part of this means that the financial income of the parents is waived. It's not considered. And so this is a great service that's available to anyone or most anyone who has children with special needs, because most of those individuals are eligible to sign out for Medicaid waiver free of charge. The kids are eligible because of their condition or their particular diagnosis. I know in California, Medi-Cal is the one who administers the Medicaid waiver. And so I would encourage you to reach out to your regional center, which is administered through the Department of Developmental Services. They can help to get you on that path to figure out, is my child eligible for Medicaid waiver? What's the documentation and paperwork that I need to fill out? It can, like with all of these systems, it can sometimes take some time to actually get approved and get on that Medicaid waiver. But I encourage you, especially if you have a young child, to take some time to research and figure out if they're eligible for Medicaid waiver, because even if it takes 6 months or a year to finally get them enrolled in that program, you'll have that access to that for a long period of time. And like I said at the top, having a secondary option to serve as that safety net and provide a little bit of a buffer can make a really big difference.
Totally. And yes, just to call out, the regional centers are what these government centers are called in California, but it does vary a bit by state where you want to go for this. But yes, I know most states do have waiver programs and can be super financially beneficial for families. So I'm glad you talked about that. And okay, so another situation we hear about, what if there's a provider contracting or getting in network with insurance companies can be a huge pain for a lot of therapists.
Yep.
Often I know families are seeing or want to choose to see therapists that are not covered by insurance. So if you find yourself in that situation, what would you recommend?
Yep, absolutely. Let's see. So a few recommendations. The first is that if it's a specialist or a particular type of provider that offers a very unique skill set, let's say you're trying to see a hematologist who are usually few and far between across this country, then you can apply for what's called a gap exception. And a gap exception, again, it's another piece of our terminology and vocabulary we're going through today, but a gap exception is basically where the insurance will agree to pay an otherwise out-of-network provider at an in-network rate because it's the only specialist that's available within your area. It might be 15, 20, 30-mile radius, but if they're a unique provider or one-of-a-kind provider in your area, then you can work with your insurance company to get a gap exception approved so that they're paid at an in-network rate. It's hard to do this. I'm not saying that it's easy, but if you are seeing a specialist that has a unique skill set that no one else offers, it's worth, again, calling your insurance company or asking the provider if they'll call with you or advocate for you to get that gap exception approved so that they can be compensated at an in-network rate. It can apply to your in-network deductible, and there's going to be a lot of many fewer out-of-pocket expenses on your behalf. So that would be my first recommendation. The second recommendation would be to work directly with that provider. Oftentimes, out-of-network providers are out-of-network for a reason, right? They don't want to deal with working with health insurance companies. They've just decided to go it alone, and they'd rather just have patients pay out of pocket, which is understandable because it can be a challenging process. And they also recognize that many families are unable to pay exorbitant amounts for each and every service. And so if you're receiving a recurring service, like going back to our speech therapy example, if your child is getting speech therapy every week for 52 weeks of the year, you're seeing that therapist on a very regular basis. Not only might you have developed a real relationship and rapport with them, but they also acknowledge that you're fronting a huge financial cost to be able to access their services instead of opting for an in-network provider. And so there are opportunities for you to talk with that provider about, are they willing to accept a lower rate? Like I said earlier in this presentation, the insurance companies are always negotiating with the health insurance providers where they might want to, or the health insurance companies are always negotiating with providers where the provider might want to charge $150. The insurance company says we'll accept $100. And so if you're being charged $200 every single time for an out-of-network speech therapy visit, it's absolutely reasonable to talk with that provider, especially if you have a relationship with them, and see if they would accept a discounted rate for those recurring services. So I know it can be hard and challenging to have those, financial conversations. It can certainly feel uncomfortable at times, but providers also are, by and large, wonderful individuals who are there to help your child and care for the well-being of them and your family and want to be able to work with you. And it's also beneficial to them because they're receiving your services not just on a one-off basis, but in this example, every week for the entire year. And so they're still being compensated well for their services, and you might be able to work out an agreement with them. So it can be challenging going out of network. I mentioned the higher cost, the paperwork. There are lots of reasons to do your best to try to stay in network, but I encourage you to either see if a gap exception is an option or to work directly with that provider to see if there's a negotiated rate that they'd be willing to accept, especially if those services are recurring. And the last thing I'll mention, and I think we'll touch on this in a moment here, is you can also use special accounts that are dedicated for healthcare expenses to pay for some of these services, which can also alleviate a little bit of that financial burden.
Totally. Yes. Two quick follow-ups before we get into that. I hear a lot just about waiting lists for specific types of services. Depends on the city a bit, but
Yep.
you mentioned for a gap exception with your insurance company it is often around exceptional skills. Can you also make a case with your insurance company to say I can't get in with anyone in network and get an exception, or is that not as
Yeah,
much?
I I would say like in general, gap exceptions are hard to get, and I don't know all of the criteria for what's included or excluded for a gap exception. But I remember seeing this all the time, where there was a 6 month waiting list for a behavioral health provider or whoever it might have been. And so I encourage you again, reach out to your insurance company and say, hey, it's a 6 month wait. There's this out of network provider who can see me immediately. Can we do a gap exception? Is that an option? Talk to your HR as well about, is this something that they can help you with at all as they're working with that insurance company. So I can't say definitively if that would work, but I would say more communication the better when it comes to talking with HR and talking with your insurance company, so that at least everyone is on the same page in terms of the types of costs that you're expecting to incur if you make that decision.
Totally. What's that phrase? It's the answer to unasked questions is always no. So
Yep,
definitely
exactly.
there to ask. All right. Ooh, great question. So
Mm.
something I've heard you talk a lot about before is just when is the right time to pay for medical services?
Yeah, absolutely. It's a good question, and I think that it can be pretty counterintuitive for a lot of people. Oftentimes, we'll receive whatever it might be, an electrical bill, a utility bill, a bill for any type of service, and you see the total dollar amount, and you go online, you write a check or whatever it might be, and you pay for those services. Like, it's pretty cut and dry and easy. And with healthcare, as with lots of areas with healthcare, it's a little bit more complicated. And so my recommendation is that when you receive a bill from a hospital or a provider or whatever that organization is, first pause and take a breath and figure out what this all means. There's usually a lot of information in that bill. It can have a list of all the different procedures that were rendered for a hospital visit, and then eventually somewhere near the bottom, they're going to say the total dollar amount that you owe. And sometimes, because healthcare unfortunately is not nearly as transparent as it could be, you were expecting a very smaller amount, and suddenly you're being billed lots of money, and it can feel overwhelming and scary. So take that beat, and as you're taking your breath, and once you've sort of figured out what that total amount is that they're billing you, then it's important to cross-reference the bill that you're receiving from the hospital or the provider with what's called an explanation of benefits from your health insurance company. And so an explanation of benefits is basically a receipt or an explanation of every single procedure that is billed to the health insurance company. And so again, like our example from earlier, a speech therapist charged $150. They're actually allowed to charge $100. And so that explanation of benefits would show there's a discount from the contract of the insurance company, and the actual owed amount is $100. And what can happen, and I see this a lot, especially with hospital visits, is that you've seen 3, 4, 5 different specialists, tons of different nurse practitioners. There's all sorts of different people that are billing for different services. And it can quickly get really overwhelming and complicated, both for the hospital's administration department, the health insurance company, and of course that ends up landing on your shoulders. And so it's important to cross-reference with the explanation of benefits, because what will happen is once all those claims have time to process, and sometimes it can take a couple of months for all the claims to fully process, your health insurance will say, for all these services, you owe $1,000. But the first bill that you got, especially if the hospital happened to bill you right away, might say that you owe $2,000. And that didn't account for the contracted rates, all of the other reductions or discounts or bundled payments that a health insurance company might have with that hospital system. And so it's really important to cross-reference what your actual bill is with the explanation of benefits from your health insurance company. And this is an example where it could be a great idea to call the health insurance company and say, hey, I'm being billed from this hospital X amount of money. Is this actually the right amount? Can you make sure that I'm paying the right amount? That's something that is their bread and butter, and they should be able to help you figure out what you actually owe. So it's important to take a breath, figure out, what do I actually owe? Does it match with what the hospital is billing me? Because maybe some of you have experienced this, but I know that I've had the experience where I'll receive a bill from a hospital, 3 weeks later I receive a bill with a different dollar amount, and then 3 weeks later I receive another bill with yet another dollar amount. And so it's a messy system. There's lots of room for improvement. But at least on an individual level, I encourage you to take a look at that bill, compare it with the explanation of benefits. And importantly, if that explanation of benefits says that a particular service was denied or it wasn't covered and you're ending up being charged for these services, it's important to figure out, does the explanation of benefits actually say that you're responsible or that the hospital is responsible? Because again, getting into the weeds here, but like for particular in-network providers, they're expected to submit prior authorizations to the health insurance company. And if they didn't submit a prior authorization for a particular service, then the hospital is the one on the hook for paying for those services, not you as the individual. That's not your fault. And so it's really important to figure out what that total dollar amount is showing on the explanation of benefits. And if there are services that are showing is not covered and the hospital's responsibility, reach out to your health insurance company and talk to them about, hey, I'm being billed for this. And they'll call that hospital and work directly with them. Because like I said, if they're in network, it's a contracted provider, they're expected to charge a certain amount or not charge a certain amount for various services. And so this is a dispute between the health insurance company and the hospital provider. And you can wait and sit a little bit and until they sort out that dispute before you go ahead and pay anything.
That easy, huh?
Yep.
It's super helpful. It's wild how challenging all of this can be. So thank you for helping us through it.
Yeah, absolutely.
You alluded to this next stuff a little bit earlier, but just what is an HSA and FSA and how can families be using these?
Yeah, absolutely. These are great tools and resources that have only really become available over the last 10 or 15 years. And it's something that I think most families are not always aware of. So it's important to think about. At a high level, both HSAs, which is called a health savings account, and an FSA, which is a flexible spending account, are special savings accounts that are specifically intended for health expenses. And typically how it works is you contribute to that health savings or flexible spending account on a tax-free basis, or pre-tax rather, and so you're not paying taxes on that money. It goes into the special account, and then you're able to use those dollars to pay for health expenses over the duration of that year or beyond. The big difference between a flexible spending account and a health savings account is that a flexible spending account is typically owned by your employer group, and there's a time limit in terms of when you have to use those dollars by. And so usually you have a year to use the money that's put into a flexible spending account, and then each year that dollar amount resets. The benefit is that oftentimes employers will contribute money to a flexible spending account, and so it's sort of free money that you can use for anticipated health expenses over the course of the year. The downside is that, again, it usually doesn't roll over, and so it's kind of a use it or lose it situation. For a health savings account, however, how that works is that that's your account to keep forever. And so if you have $500 in the account and you only use $100 in a given year, you'll still have $400 that next year to use for future expenses. And that account sticks with you even if you change employer group. So that's your money to keep. And so you're able to use that and build that into your budget as you're planning for health expenses. Typically, both health savings account and flexible spending account are only available for higher deductible health plans. And so if you do make the choice to choose a $2,000 or $3,000 deductible plan, like we talked about at the beginning of this presentation, certainly look into contributing to one of these accounts because it can make a big difference, depending on your tax bracket, to be able to have those pre-tax dollars in there. It can result in pretty considerable savings. And the other, sort of the last plug I would put in for why to use an HSA or an FSA is that there's a wide range of services that are eligible to be paid for through one of these special accounts. So all of your standard medical expenses like primary care visit, a speech therapy, getting durable medical equipment, all those sort of expected expenses, you're allowed to use one of these accounts for. And you're typically allowed to use the accounts for all sorts of other things like you could buy sunscreen with it. You can buy your over-the-counter medications. I even spoke to a family at one point that was using their HSA to pay for a service animal that they had. And so there's a wide range of areas that you can use these accounts for. There's tons of lists online. It just takes a quick search to say, HSA or FSA eligible expenses. But I know it can be tricky when budgeting to feel like you're putting money into the separate account that has restrictions on it. But I would reassure you that there's a lot of sort of daily health expenses that you can use this on. And so I'm sure that you'll be able to find good ways to be able to use this money and hopefully save a little bit on the tax dollars in the process.
Love that. I love that all the creative ways you can use that. And I know lists of I'm pretty sure, keep me honest, Max, but there are lists of the different things you can use
Yep.
for both of those on government websites that are pretty easy to find. We can
Yep.
post this in the chat too.
Pretty easy to find, and you can like search for different services. So yeah, it's easy to figure out what you can and can't use it for.
Love it. Let's see. One quick question that came in here before we go on to this next topic is, some folks have heard that it's a lot of paperwork to have an HSA. Is that generally true?
I would say generally it's actually not that much paperwork. So usually what happens is that if you have an HSA, oftentimes you'll actually be given a card, like basically a debit card that links directly to your HSA account. And so if you have $500 in that account, you have this card that has $500 on it, and you have to use it for health expenses. And so if you go to your primary care visit, you could pay using that special card. So it used to be that you had to submit all of these receipts, and it was a very complex process, but more and more HSAs and FSAs are coming into the 21st century, and they're allowing people to be able to have these cards that they can use for the expenses. So I will say, if you do use your HSA or FSA, again, it depends how detail oriented you are, but it's often a good idea to save those receipts that you get for the services, just in case you were to ever experience an audit or something like that. You would be able to show that you use these expenses for an approved health expense. So I don't think it's too much paperwork, especially if we're able to pay up front with the card and then just keep those receipts in a file or online somewhere.
Totally. I know I like to take photos on my phone because I always lose them. So that's helpful for anyone else. Awesome. Oh, another question here. For Medi-Cal, does this need to be renewed every year? And I think maybe this family can clarify, is this specifically in reference to HSAs and FSAs? I think so.
Maybe it was related to the earlier Medi-Cal discussion we were having, and for Medicaid waiver. So at least for Medicaid waiver, usually once you have an applicable diagnosis, you have access to those services for a number of years. I'm not a public benefits expert, so I would certainly encourage you to talk to your regional experts about if there is any additional validation or confirmation of diagnoses that are needed over years. But usually access to Medicaid waiver is something that sticks with you for a period of time, at least a few years. It might be well beyond that. It's not something that needs to be renewed every single year.
Got it. For that secondary insurance that we were talking
Precisely.
about, for example. Yes. Okay. Love it. Yep, that makes sense. Awesome. All right. And another one here is just, I hope this isn't everyone, but I know I've been in situations where claims have been denied and insurance tries to tell me that I actually owe lots of money for different healthcare services I've received. Any pro tips that you have, what to do here would be awesome.
Yeah, absolutely. Well, it's a good question here because it's somewhat a culmination of a lot of these pieces that we've been talking about. The first step is to figure out what's going on. Why is the claim being denied? We talked earlier about, common reasons are that it's either a non-covered benefit or that it's missing medical necessity or didn't meet medical necessity. And so if it's truly a non-covered benefit, if you have a plan that doesn't cover IVIG, then that can be a challenging situation. And I would encourage you to reach out to community resources. This is a perfect example of where secondary insurance would come into play. But if it's truly a non-covered service by the plan, then I would recommend not wasting your time trying to dispute it back and forth with the insurance company, because it's going to be a lot of frustration, a lot of grief, and it's likely not going to get you anywhere. However, oftentimes claims are denied for many reasons beyond the fact that it's a non-covered service. It might be that it didn't meet medical necessity, or they didn't submit the correct paperwork, or whatever it might be. And so I would encourage you to, again, take a look at that explanation of benefits, and it'll say a denial reason. And if it says that it didn't meet medical necessity, or one of those other reasons that we mentioned, then you can reach out to your provider and say, and talk with them about, hey, it looks like this was denied through my insurance. Can you help me, what's called appeal this decision? And so what an appeal is the provider will put together some paperwork with supplemental information showing that indeed this individual needed speech therapy. Here's the diagnosis. Here's how long I've been seeing them. It provides additional rationale behind why these services are needed. And then they're able to submit that to the health insurance company. And then a doctor at the health insurance company will review that paperwork and figure out, does this actually fall within our plan guidelines or does it not? And if it does fall within those plan guidelines, then that claim will be overturned and it will be processed per your normal benefits. And so providers always have a lot on their plate between seeing all the different patients, doing all this administrative work. There's a lot that they're trying to juggle. And so oftentimes they might forget to submit key piece of information or submit the wrong claim or whatever it might be. And so again, taking a look at that explanation of benefits is key to figure out why it's being denied and then taking the appropriate path from there.
Mm-hmm. That's super helpful. I can imagine a decision tree flow chart that we should make after this. So, yes,
Sounds like fun.
That's all super helpful. Before we close here, are there any lingering questions from folks in the audience? No, we went through a lot there. So if anyone has specific questions right now, they can throw them in the chat. And if nothing's coming to mind right now, as Max shared earlier and I shared earlier, we do have a free community for families with lots of great content, other families, experts like Max, who questions can be asked asynchronously on an ongoing basis, and you can get answers there too. Okay, let's see. Yeah, I guess if no questions come in, Max, while we're at the end here, is there anything that we haven't talked about, just advice you found yourself giving a lot when working with families, or anything else that came up that we haven't touched on?
Yeah, absolutely. I mean, like I said earlier, like there's so many different pieces to juggle when you have a child with special needs. You have to deal with health insurance, figuring out an IEP, figuring out community resources, figuring out like all these different components. And so it takes a lot of work and dedication and passion as a parent. And so I just want to appreciate all of you out there that are doing all that advocacy for your children, because it doesn't go unnoticed. It can feel fruitless at times. That persistence oftentimes really pays off. I would just encourage you to continue to connect with other families that are in similar situations to you, whether it's related to health insurance challenges that they're having, or other other obstacles that come up over the trajectory of their life course. I think that it can be hard to do this work alone. Like, all of us know bits and pieces of this broader process, and the only way that we can sort of accomplish it is by teaming up together and being able to tap into everyone's individual knowledge. So I encourage you to find communities, whether it's through the community forums that Beaming has, or through other networks as well, to make those connections with other parents who are in your situation, because there's so much to learn about the system. No one person can know it all, and by building that community and having people around you to support you in that process, it can hopefully make it a little bit easier.
Totally. Great advice. Awesome. Well, Max, oh, yes. Oh, great question. Is the session being recorded? Yes, it is. This is recorded. I'll be sharing, and I've been taking notes as we go, a little summary of sort of the key takeaways and link to the recording. Another great question here. Insurance companies paying out-of-network benefits at 110% of Medicaid rates. Is that typical?
So what I will say is that typically commercial insurance, so insurance that you get through your employer group, reimburses providers at much higher rates than Medicaid or Medicare. Typically the federal government, because it's this massive organization, has more negotiating power, so they will reimburse providers considerably less for services. And so it is typical that a commercial insurance is going to pay those providers a lot more. And I think it goes back to my earlier point that having a discussion with an out-of-network provider about what they're charging for services and what you're able to pay can sometimes feel uncomfortable, but the insurance company might be paying them a considerable amount for the services, especially if you have commercial insurance. So figuring out what you're actually responsible for, I think, is really key. One other last comment I would make, I was thinking about sort of final takeaways and tips, is, and on this topic of negotiation, oftentimes what will happen is if you incur a one-time really large bill, let's say you or your child is hospitalized and there's a $5,000 or $6,000 bill that comes through, it's very common that hospital systems are willing to negotiate with families in terms of what that total dollar amount is, because they fully recognize that this amount, especially if you have a high deductible, might be unattainable for many families. People don't just have that money that they can suddenly pay for it. And so if you're able to scrap together a portion of those dollars, or if you're able to come up with, $3,000 all at once, and you can pay that in one lump sum, I fully recognize that's not the case for a lot of people, and many are not in that situation. But if you're able to do that, oftentimes the hospital will say, yes, we'll take a one-time $3,000 sum and we will write off the rest of the expenses. So it can be really overwhelming and scary when you have a serious adverse event and you're stuck with this huge bill. But if you're able to pool together some resources and offer a one-time payment, they're almost always willing to negotiate with you, because the alternative for the hospitals is that it might take years of paying $50 incremental payments over that time. And so they'd be willing to take a single one-time discounted rate so that they can get a large portion of it and you're able to walk away with some cost savings. So fully recognize that that's not feasible or accountable for many families, but I would encourage you to feel comfortable negotiating with providers and hospital systems and asking them what financial supports they have available. Large hospital systems will almost always have financial supports available, and it's worth talking with them about what those options are so that you can alleviate some of that burden.
Awesome. That's great. And then just to make sure we get the heart of this last question, that higher rates for commercial insurers paying doctors, those higher rates makes a lot of sense. And something like higher than the Medicaid rate would be very typical for out-of-network providers too. Because I know for out-of-network providers, we talked about the ones that aren't contracted with your insurance plan, typically the reimbursement is a lot lower than the full rate for those out-of-network providers, but that still might be higher than the Medicaid rate, it sounds like.
Exactly. It might still be higher than the Medicaid rate, and it's just important to understand when you're going to hit that deductible level for out-of-network, because if your insurance company is still paying them a good rate, that's great to hear, but you want to make sure that you're not paying a many $1,000 deductible before that insurance kicks in with the payment.
Yeah. Okay. Awesome. Well, Max, thank you so much. And thank you everyone for joining us here tonight. We will be sharing out the recording and some takeaways. And for any questions that come up later, any shower thoughts, always feel free to post those in our community, and we will hopefully see you all soon.
Thanks for having me, Missy. It was a great time.
Thanks. Good to see you, Max.
Talk later.